Hello everyone, welcome back to my YouTube channel. Today I am going to discuss about the anatomy of parotid gland. From this video you will learn about the general features of the parotid gland and the location, parts, the surfaces and the borders of the parotid gland and the processes as well as the surface marking and relations of the parotid gland and the contents of the parotid glands and the structures of the parotid gland and how they are exit from the parotid gland, as well as secretomotor innervation of the parotid gland, and finally clinical importance of parotid gland. Parotid gland is the largest among the salivary glands, and when we talk about the general features of the parotid gland, it weighs about 25 milligrams and resembles in shape an inverted pyramid. It is a compound tubulo-alveolar type of gland consisting of mainly serous acini. Parotid duct carries watery secretion of the gland to vestibule of the mouth. You can see the parotid duct here. This is the parotid gland, and the secretions form saliva and helps in moistening the mouth as well as in the formation of bolus of food. Let's have a look on the location of the parotid gland. As you can see here, the parotid gland is located below, in front and behind the ear lobule. Here you cannot see the ear lobule. Here is the external auditory meatus. Here is the zygomatic arch. So, in this area is the ear lobule. So, parotid gland is located below, in front and behind the ear lobule. It fills the hollow between the ramus of the mandible and the mastoid process. Here is the mastoid process, and here is the ramus of the mandible. You cannot see the ramus of the mandible because it is posterior to the parotid gland, and it extends between external acoustic meatus here and above to just posterior inferior to the angle of mandible. Here is the angle of mandible in this area. So it is posterior inferior to the angle of mandible. Posteriorly it overlaps the sternocleidomastoid muscle, and anteriorly parotid gland crosses masseter muscle here. So anteriorly there is masseter muscle, posteriorly there is sternocleidomastoid muscle, and usually parotid gland located below, in front and behind the ear lobule. Let's see what are the surface markings of the parotid gland. First, to draw a curved anterior border, here anterior border there are 3 points marked as follow. You can see the first point, it is coinciding with the head of the mandible in front of the tragus of the ear. Then the second point is marked on the center of the masseter muscle here. And then the third point, you can see it is just posterior inferior to the angle of the mandible here. So these are the 3 points, and we have to match these 3 points to draw the curved anterior border. Then the posterior border is drawn by joining the third point to the fourth point here. Posterior border is this one. So the fourth point is marked at the upper end of the anterior margin of the mastoid process. Here, this is the anterior margin of the mastoid process. So the fourth point is marked at the anterior margin of the or the upper end of the anterior margin of the mastoid process. Then you have to match this. You have to draw a line from the third point to the fourth point to draw the posterior border of the parotid gland. Then, as you can see here, the line joining from the first point to the fourth point represents the upper border of the parotid gland here. This line represents the upper border of the parotid gland. This line is concave upward and may drawn either across the lobule of the ear or by lifting the lobule of the ear. So that is how you should do the surface marking of the parotid gland. Let's see what are the parts of the parotid gland and the surfaces as well as borders of the parotid gland. I told you earlier as well, the shape of the parotid gland is look like an inverted pyramid. So this parotid gland has a rounded apex here, rounded apex, and it points inferiorly. This is the rounded apex. Also, it has a narrow base. Here, look at this picture. As according to this picture, you can see there are three surfaces. As superficial surface here, this superficial surface means the lateral surface, and here this is the posteromedial surface, and here this is the anteromedial surface. Here you have medial border, here you have posterior border, and here you have anterior border. So there is a superior surface or the surface of the base. You cannot see that surface here. So there are altogether four surfaces: superior surface or base, then the superficial surface or the lateral surface, then the posteromedial surface, and the anteromedial surface. Now you have to imagine how the parotid gland is situated like a 3D structure. I cannot show it as a 3D structure here. There are only three borders as mentioned here: the medial border, posterior border, and the anterior border. Here also you can see the medial border, anterior border, and the posterior border. As you can see here, the medial border separates the anteromedial surface and the posteromedial surface. Then the anterior border separates the anteromedial surface from the superficial surface. Then the posterior border separates the superficial surface from the posteromedial surface. Let's see what are the relations of the parotid gland. From this picture, you can see very clearly there are several relations of the parotid gland, and this is like a cross section of the parotid gland. Here is the lateral surface or the superficial surface. As you can see here, this lateral surface is covered by the skin, then the superficial fascia, including posterior fibers of the platysma, and the dense capsule of the parotid gland. Here, the superficial parotid lymph nodes and cutaneous twigs of great auricular nerve are located in the superficial fascia. These are the lymph nodes in the lateral surface. Then the anteromedial surface. This part is the anteromedial surface. So, it is closely related to the ramus of the mandible. This is the ramus of the mandible. This is the ramus of the mandible. From externally, masseter muscle is attached to this ramus of the mandible. From internally, medial pterygoid muscle is attached to this ramus of the mandible. So, these two muscles, medial pterygoid muscle as well as the masseter muscle with the ramus of the mandible, is a relation of the anteromedial surface of the parotid gland. Then here this area is the posteromedial surface. It is very large, hence comes in contact with many structures. You can see as well, there are many structures which is closely related to the posteromedial surface. It is related to the mastoid process. You can see this is the mastoid process, and there are two muscles attached to the mastoid process. They are sternocleidomastoid muscle. Here you can see part of this muscle. This is the sternocleidomastoid muscle which is attached to this mastoid process, and here this is the posterior belly of digastric which is attached to the mastoid process. It is also related to the styloid process and the three muscles attached to it. This is the styloid process. You can see very clearly the three muscles attached to it are stylohyoid. This muscle is the stylohyoid. SH means stylohyoid. Then styloglossus. SG means styloglossus muscle. Then SP means stylopharyngeus muscle. Stylopharyngeus muscle here. Then the internal carotid artery. This one is the internal carotid artery and internal jugular vein are separated from the parotid gland by the styloid apparatus. You can see this is the styloid process and the muscles attached to them, attached to it. So it separates this internal carotid artery and internal jugular vein from the parotid gland. Last four cranial nerves. They are glossopharyngeal nerve, then the vagus nerve, then the spinal accessory nerve, and hypoglossal nerve are the nerves which related to this posteromedial aspect of the parotid gland. External carotid artery grooves this surface before entering the gland. Here is the medial border. This medial border of the gland may project medially so much that it touches the lateral wall of the oropharynx. This you can see, this is the pharyngeal wall. So it touches the oropharynx, the lateral wall of the oropharynx. Hence the medial border is also known as the pharyngeal border as well. This border is also known as the pharyngeal border as well. Narrow superior surface you cannot see here. Is related to external acoustic meatus and temporomandibular joint. The auriculotemporal nerve is embedded in the capsule near the superior surface. Then, the apex lies between sternocleidomastoid and muscle and the angle of mandible. It overlaps the posterior belly of the digastric muscle. So, those are the relations of the parotid gland. There are many relations. You cannot study from a normal picture, so you have to study those relations a picture like this, in a picture like this, so you can easily remember the relations which are belong to this anteromedial surface, then posterior medial surface, then to the lateral surface, then to the medial border. Those are the relations. I hope you understand clearly. There are three processes of the parotid gland and you have to know those as well. Actually, I cannot show the three processes very clearly in the parotid gland, but I will tell you what are those three processes and where those are located. There is a process called glenoid process. It is a part of the base or superior surface. So the glenoid process is a part of base or superior surface of the gland and it is lodged between external acoustic meatus and the capsule of the temporomandibular joint. So the swelling and inflammation of the glenoid process, example like in mums, give rise to pain during eating. So the glenoid process should be located somewhere here. Then there is a pterygoid process, which is a extension of the deep part of the gland. You cannot see the deep part of the gland here, but remember that it is between medial pterygoid muscle and the ramus of the mandible. Then the third process is the facial process, which is the part that extend on the face along the duct. Somewhere here there should be the facial process of the parotid gland. A part of it becomes separate above the duct as accessory parotid gland. You can see the accessory parotid gland here. This is the parotid duct. So in this area there is the process called facial process. So I hope you understand clearly. There are three processes of the parotid gland. One is the glenoid process, then there is a pterygoid process, then the other one is the facial process. Let's see what are the contents of the parotid gland from this picture. Here, this is the superficial surface or the lateral surface. Here is the anteromedial surface, and this part is the posteromedial surface, and this is the medial border. This is the posterior border, and this is the anterior border. So, when we talk about the contents of the parotid gland, the facial nerve enters the gland through its posteromedial surface. It enters here from the posteromedial surface, and it divides in the gland into two main divisions called temporofacial and cervicofacial. Two main divisions, what are they? Temporofacial and cervicofacial nerves, from which terminal branches are arised. Facial nerve and its branches lie in the superficial plane of the parotid gland, like here. Then the retromandibular vein is formed in the substance of the gland by the union of superficial temporal and maxillary veins. Towards the apex of the gland, the retromandibular vein divides in anterior and posterior division. So, this is the retromandibular vein. So, remember that most superficially there is facial nerve, then you have the retromandibular vein. Deeply, the external carotid artery enters the parotid gland through its posteromedial surface, and it divides in two branches as superficial temporal and maxillary artery at the level of and posterior to the neck of the mandible. So, the facial nerve is the most superficial structure inside the gland. Retromandibular vein is deeper to facial nerve, and then the external carotid artery is the most deepest one. The nerve and the vein constitute a plane called fasciovenous plane. This nerve and the vein constitute of a plane called fasciovenous plane, which divides the gland into superficial part and deep part. Apart from these three major structures, the parotid gland also contains deep group of parotid lymph nodes and the auricular temporal nerve as well. When we talk about the structures that exit from the gland, here you can see very clearly the branches of the facial nerve. There are 5 branches of the facial nerve mainly. The structures that leave the anterior border are the zygomatic branch of the facial nerve here, and the transverse facial vessels. Here you can see transverse facial artery, upper buccal branch of the facial nerve. Here, this is the upper buccal branch. Then the parotid duct here, and the lower buccal branch of the facial nerve, and the marginal mandibular branch of the facial nerve. Base or the superior surface gives passage to the temporal branch of the facial nerve. You can see very clearly the base here. So, from the base, temporal branch of the facial nerve exit the gland. And the auricular temporal nerve, this is the auricular temporal nerve, it also exits from the gland from the superior surface or the base of the gland. And also the superficial temporal artery also exit from the superior surface or the base of the gland. Then the apex gives passage to cervical branch of the facial nerve. Here you can see very clearly this part is the apex of the parotid gland. You can see the cervical branch of the of the facial nerve goes exit the gland from the apex of the parotid gland with the retromandibular vein. And also you can see the two divisions as anterior division and posterior division here. Maxillary artery leaves through anteromedial surface, but you cannot see it here. Remember that the maxillary artery leaves the gland through the anteromedial surface. So those are the structures that leaves the gland from 4 different surfaces or 4 different areas of the gland. Here in this picture you can see the parotid duct, and it is 5 centimeters long. It drains the secretions of the gland into the vestibule of the mouth. It emerges from the anterior border of the parotid gland along with the branches of the facial nerve and crosses the masseter muscle. When we talk about the parotid duct or Stenson's duct, it emerges from the anterior border. You can see in this picture as well, it emerges from the anterior border, and at the anterior margin of the masseter muscle. Here, this one is the masseter muscle. So, in the anterior margin of the masseter muscle, it turns sharply medially to pierce the buccal pad of fat, buccopharyngeal fascia, and buccinator muscle as well as the buccal mucosa. It opens into the vestibule of the mouth at the level of crown of upper second molar tooth. It's the oblique course of the duct between the buccinator and the oral mucosa act as a valve which prevents distension of the parotid duct during forceful blowing. You can see very clearly how it goes or how it bends from or turns medially from the anterior border of the masseter muscle. You should know the secretomotor innervation of the parotid gland as well. So let's discuss about the secretomotor innervation of the parotid gland. The preganglionic parasympathetic fibers take in origin in the inferior salivary nucleus. Here you can see the inferior salivary nucleus in the medulla oblongata are carried in the glossopharyngeal nerve. That means cranial nerve 9, glossopharyngeal nerve, ninth cranial nerve. These fibers leave the glossopharyngeal nerve in its tympanic branch. Those fibers leave in a tympanic branch, and then it enters into the middle ear. Here it breaks into the tympanic plexus, and then it gives origin to the lesser petrosal nerve. You can see very clearly it gives origin to the lesser petrosal nerve. This nerve enters into the middle cranial fossa, from where it enters the infratemporal fossa to terminate in the otic ganglion. This lesser petrosal nerve, you can see, terminates in the otic ganglion. Then postganglionic fibers from the ganglion join auriculotemporal nerve, which hands over the secretomotor fibers to the gland. So you have to remember that postganglionic fibers to the parotid gland is carried with the auriculotemporal nerve, and the preganglionic parasympathetic fibers are carried through the glossopharyngeal nerve towards this tympanic plexus, and finally it becomes a lesser petrosal nerve, and it ended up in the otic ganglion like that. You have to remember those the names of those nerves very clearly, and the parasympathetic ganglion which supplies which give rise to secretomotor innervation to the parotid gland. It is the otic ganglion. Then the clinical correlations of the parotid gland. Here you can see here this is the parotid abscess, and it presents as a slight swelling with redness on the surface of the swelling accompanied by acute excruciating pain. There is acute pain here. It results from bacterial parotitis. This parotid abscess does not show fluctuation when ripe due to its unyielding capsule. So you have to put a surgical incision here, like here, and drain the abscess. You have to put a transverse incision which is transversely placed, because there are the uh, branches of the facial nerve. As I discussed earlier, there are 5 branches emerging from the parotid gland, so you have to preserve them. Therefore, you should put a transverse incision like here. There is another condition called parotid swelling, which may be due to inflammation of the gland or sometimes may be due to tumors, which can be benign tumor or malignant tumor. Since the gland is positioned below, behind and in front of the ear lobule, like here, um, just below the lobule of the ear, um, the swelling of the gland can be obliterate the normal hollow of the ear. Tumors of the parotid gland are very common, and a painless low-growing tumor is benign in nature. It does not damage the facial nerve. But a malignant growth, if a malignant growth, it is characterized by rapidly growing painful swelling, which involves the facial nerve as well. So it can produce facial nerve palsy as well. So that is about the clinical correlation of the parotid gland. I hope you understand the very detailed information about the parotid gland, or the information from A to Z uh, about the parotid gland. And if you like this video, please put a like and a comment in the comment section as well, and subscribe into my channel for more videos. And thank you for watching.